When when you're in the polling, it's indicated that the top issues consistently have been healthcare in Virginia and economy budget. So when you're out canvassing and or knocking on doors and campaigning, is that what you're hearing?
Yeah, you hear the consensus that this is a humanitarian right. This should not be on the chopping block. We are not attacking our Virginians or anyone else for that matter. Should be a right for people to live and thrive and be able to have the services they need in order to then take the next steps, being, able to provide for their families or, whatever the activities that they want to engage in. This is just important that we treat people with humanitarian dignity and respect.
I mean, people are raising this unprompted. They're just like, when you're at the door, and
really
you say, what's on your mind? And
they feel attacked.
Yeah.
And a lot of my district is a lot of service members. So this impacts our veterans. This impacts, people that are barely making it and need the, the GOP stigmatizes Medicaid and people who need it, and maybe it's a temporary solution, or maybe there's some length time that they need it for whatever reasons. But this is not something that is or should be used as an attack on our constituents. We need to use, I don't want to say common sense approaches, but just look at it in a way that we're here to help all Virginians live, thrive, and be successful.
Pragmatically?
And pragmatic, there you go.
It's also a unifier in the sense that there are a lot of things that divide us between Northern Virginia and the rest of Virginia, but not this one. I hear it when we're out in rural Virginia, we hear it in the exurbs, we hear it in the suburbs, in our inner cities. All of these are deeply affected by Medicaid expansion. You have clinics that are closing their doors, in some cases hospitals that may shut down. Obviously we have with the opioid crisis and that's hit rural Virginia but has spread to other parts. 3 Virginians die every day of the opioid crisis. This provides addiction services. We have a sense now of a generation that understands we need to treat addiction as a public health crisis and not as a criminal crisis. I hear that as much in Trump counties as I do in Clinton counties. So I think with Medicaid expansion, as well as quality of education and a pathway into the workforce, whether that's community college, apprenticeship program, trade school, I think that issue of quality schools and pathway into the workforce and Medicaid expansion are 2 of the things I hear in every zip code around Virginia.
Absolutely.
Right. So Trump voters, you spent a lot of time in Trump country or whatever you want to call it, but you found that they want Medicaid expansion or what? Because their delegates are not obviously voting for that.
That's right. I think one of the big mistakes we make is assuming that these Republican legislators represent their constituents, when in fact they're representing the Koch brothers and the large donors and ALEC that have this ideological agenda. The fact of the matter is, when you're in Southwest Virginia, they can literally look across the border into Kentucky and see cousins who have the Medicaid expansion or saying, why the heck don't we have it on this side, as long as you don't call it Obamacare. The fact of the matter is, people believe that the working poor getting this kind of Medicaid coverage is the right thing to do morally and the right thing to do economically, and giving people a little bit of room to move into the working and middle class. So we absolutely see support for it across these red counties. The problem we have, as you know, and Alex, you know as well, there's very little coverage of what happens in Richmond.
Yeah.
And so, people get their news now from nationalized sources, and therefore what they hear about is the federal fight. And a lot of these Medicaid expansion fights really never broke through. And to be honest, we either didn't have Democrats running in those seats, or if they did, they didn't necessarily want to touch what was then seen as unpopular with the Affordable Care Act. Now we actually see people paying attention locally. We have really strong and dynamic Democrats running, and we have them running very strongly on this issue. So this election is probably the first time these Republican legislators are going to be held accountable for things that their very conservative constituents do not like and support, which is the denial of the Medicaid expansion.
Huh, interesting.
They understand that we will save $73 million a year. This is also, they're talking about a fiscal forefront, and we all understand the humanitarian and the right thing to do portion of this, but then they were like, if we're going to talk about fiscal responsibilities, which is one of the talking points our GOP members run on, why doesn't this make sense to you? And again, looking in other adjacent states who have expanded Medicaid, it's working. So, there you go.
Right.
There you have it. And I think one of the disconnects, we used to have a local paper, Potomac News, that we were able to deliver in our forefront. And somebody said the other day in one of our meet and greets that, hey, we don't get the paper at our doorstep anymore. And some of our constituents may not read online articles.
You need to send them to InsideNova.com.
Yeah, or
Well,
bluevirginia.us.
They're not into the computer, or they hear they're like, I'm not going on the computer, you know, whatever the issue, their concern is. But we used to have a delivery system where papers
Yeah.
touched on the local things that were going on in Richmond. You could read it at your doorstep. And so I'm not sure what the solution is if they're not connecting with the cyber world or the social media aspects. And then they have a concern about the real news or not fake news, or if this is
What to believe,
what to believe. And so it's really hard to get that communication across. Sometimes it's
Yeah.
just they see the challenges we have, they see the Trump presidency, and they want to know. As you said, we see unbelievable Democrats running for office and also on the ground getting engaged. They want change. They just know what we have now is not going to work.
Right.
The other thing just to remember is 7% of Virginians voted third party last year. And almost all of those were people who would normally have leaned Republican. And what that means is you have a significant percentage of the state that has clearly grown since the election that probably considered themselves Republican or conservative before, but they don't see themselves reflected in today's Republican Party, whether that's the extreme agenda and incompetence of the Trump administration or the increasingly counterproductive agenda in Richmond, where you see these Republican legislators go in and vote against the middle class, against the working class, against the idea of an inclusive Virginia, against affordable higher education, and a lot of folks say that doesn't sound conservative to me. That actually just sounds stupid. And
Yeah,
that's why
well,
you see a state
true.
like Texas moving forward on criminal justice reform before Virginia is. They've just run the numbers on it and said, we can't afford to have this kind of idiotic criminal code where we're spending $30,000 to incarcerate someone instead of $5,000 to get them a community college education or a trade school degree. So I think the politics around Virginia have shifted quite a bit. The parties haven't caught up to it. I think the Republicans are increasingly out of step, and that has put a lot of races like this in play where people are going to look at the individual, see someone who's lived a life, has perspective on what these programs mean, has pulled herself up by her bootstraps, and wants to just give that opportunity to others. That's something that plays in all time zones in my experience.
Right. Okay.